Bismillahirrahmanirrahim. First of all, I will congratulate all the organizers for such a magnificent, of course, it's basically second to none in the world. It's one of the highest commendable forum. So starting with, always been a pleasure to start with the slide with the paint on paper drawn by my daughter. Can I get this one? So we're talking about mesenchymal stem cells' role in controlling hyperpigmentation, a dream which is coming true. I have nothing particular to disclose. Actually, talking about the background of this study is we come across in our population which come up with pigmentation as well as contour deformities in combination. And so far, we are trying many ways to hunt this, and that may be just filling up with the fillers and dealing with the pigmentation with many aspects you better know. It was basically an offshoot of a project which was I was involved, and it was an incidental finding. My project which I was working on got published into Assam. And that was with the filling of these contour defects with the fat. And that got published. After some time, patients were kept in my follow-up, and I recognized some changes in the pigment and then planned something different. The same happened when I was dealing with the burn scars with nanofat infiltration in the scars to make them soften out, and the pigmentation was improved in that case too. Then I started off with the planned study for pigmentation, and inclusion criteria was contour deformity with hyperpigmentation in association. Patients who were having adherent skin or previously been tried with some pigmentary remedies or with having skin graft were excluded. In my patient, what I did, I just harvested, prepared the fat and injected in by fanning technique to achieve the clinical symmetry, and kept the patient under my follow-up to study. And in the meanwhile, I was having an array of different type of cannulae which were patented by my name in USPTO. So having a liberty to use different variety of fat like macro, micro, and ultimately converting into nano or even homogenized. And one of the different things which I introduced, which is also patented by my name, is a homogenizer. And it's basically a connection between the two syringes passing from one side to the other. The fat is basically homogenized, broken down into the same vesicles. And then I further introduced a small change into it, which was in the mid, and it was graduated to increase or decrease the aperture. Rather than pushing the fat from one side to the other from the single small hole, the hole was under your control. And it was gradually decreasing into from the smaller one or to starting with the bigger one, ultimately decreasing into the size to the smaller hole. So that the homogenization must be gradual. Rather than destroying the cells altogether, it must be gradually broken down and come to the level which is to be used. So in my follow-up, certain parameters were kept in my mind and they were recorded. These were the demographics of the patient's population which I had. The outcome was measured by change in color by using Image J is one of the softwares in which I calculated the change in the color density before and after my procedure. Patient satisfaction was quite good, but in objective way, if I talk, there was marked improvement in their pigmentation on the color density. This was case-to-case presentation of my patients. There was no particular complication, like if I talk of edema, bruising, they were usually happening in the donor area as well as the recipient. Ultimately, they settle by its own. These were basically the initial cases with the Romberg's disease on the forehead with pigmentation as well as the contour defect, pre and post, pigmentation improvement, and the study got published. And also got appreciated in Canadian Society of Plastic Surgery and ICAD in 2022. And that was anxiety relieving for most of my patients, which were basically a side-by-side study talking about the anxiety of the patients who were having facial lesions, and that was also got published in Malaysia. When I was presenting in Japan, one of the participants got a very beautiful question to me. This study was basically on females. And he said that the study is actually half conducted because the anxiety of the males also need to be considered too. And then later I did. And interestingly found that the anxiety of the facial lesions was more in males as compared to even females. Then I started thinking about the lesions which were not requiring any filling. They were just pigmentation, and filling was not needed that much, like the lesion on the nose. And then I planned another trial, registered on, and then started with this, dealing with the stem cells only, just injecting into the lesion without the fat. That was having the improvement. Similarly, on the lateral side of the eye, on the cheek, if you see this marked improvement in even the scarring and pigmentation. There is a pigmentation on the lab, ultimately settled down, and the study got again published in an impact factor journal. And that this year I presented in ISAPS forum and got the World Award. In conclusion, mesenchymal stem cells, they control the ambience of the tissues, which optimize the activities of the melanocytes, ultimately regulating the pigmentation. And it is one of the very strongest and powerful solutions for our pigmentary lesions. This is the institute where I graduated and I'm working in. This is my department. You can see in the surgical tower. Thank you very much for your patience.